What changes do you want to see in the healthcare policy of the United States?
The only candidate that called on our Attorney General to file a suit, called on Jim Hood to file a suit against this administration and Obamacare, because this health care bill is unconstitutional. Nowhere does it state in the Constitution that we have to utilize our tax dollars, that your tax dollars have to go to pay for my health care. So we need to repeal it and start right over. This is not a health care reform bill. This was a political reform bill to ensure that Democrats would win in 2010 and Obama would win in 2012. It has backfired. I believe it's going to be a referendum in this year on Democrats who voted for that bill, and it might trickle up to 2012. We need to repeal it, but what would I like to see? Number one, you need caps on malpractice lawsuits. Number two, you need to cover people with pre-existing conditions, and we need to hold these insurance companies accountable that drop folks, because I'll give you an example. My mother, thank you Jesus, is cancer-free, but she had cancer in 1994, colon cancer. After the colon reconnect, her insurance company dropped her. We had to pay for her colonoscopies. Now, my family was able to do that, but your average family might not be able to, especially in this economy. So people should not be penalized for getting sick. Isn't that what insurance companies are for? We should have more competition, yes, but there should be more regulation. This is, again, where the government should move in to protect the consumer. But you have special interests in Washington, D.C. on both sides. Trial lawyers who don't want malpractice caps, and insurance companies that don't want to be regulated. Last but not least, we need a bill that just has health care related issues addressed in the bill. Not other things that are tacked on, and definitely not earmarks and pork barrel spending. And this bill was, as Rahm Emanuel stated, we need to do everything we can, cut every deal that we can to get votes to get this bill through, because it's about politics.
I think Obamacare was wrong. I think it needs to be repealed in Congress. If I'm there, I will fight to have it repealed and disable that. Obamacare really provides a heavy regulation mechanism over private health insurers, and they also create a government-sponsored health plans that are going to compete with private health insurers. These private insurers will be regulated like they never have been before. People will be told who buy this health insurance what kind of care they can receive, what their doctors can do. There are requirements that private health insurers pay out 85% of the premiums they receive in benefits. It sounds good if you're an insured, but the industry average up until now has been 65%. This really means that private health insurers will go out of business when they have to take on these additional requirements, pay the overhead, pay the taxes, pay the things that they'll have to pay. They won't be able to survive. They'll go out of business. The only thing that will be left is government-sponsored health insurance plans after this is all said and done. When we have that, we're going to have basically government-sponsored health care, or government-run health care. And decisions about health care will be made at the Washington bureaucratic level. That takes freedom away from you, me, and the people around the country who want and will need health care. I think we need to have another plan. I think we need to encourage private sector reforms in health insurance. Tort reform is needed immediately. Most medicine practice now, you can almost say that, is defensive medicine, where doctors are trying to avoid lawsuits and they do things that are unnecessary. And it runs up the cost. It runs up the cost of insurance. We need tort reform to limit damage awards for punitive damages, other things that come with tort reform, which will lower economic cost and lower health insurance premiums. We need to have job portability, where people can carry insurance from job to job and not have to restart the process every time they get a new job. We need nationwide competition for health insurance. Under the current regulatory scheme, we can't have that. People can't really compare apples and oranges when they look for health insurance. We need to have that so that there are comparable nationwide health plans offered and interject competition in the system. We also need to reward healthy lifestyle choices. People who live a healthy lifestyle should be rewarded in the form of lower premiums. There's a set amount that insurers can discount for this now, and that needs to be removed, and people can go and be encouraged to do better. It will help them economically. There's some other things we can do. We can increase the deductibility of health insurance premiums, and also there are a lot of free clinics springing up, which are an extremely good idea. Donated time, donated buildings, donated equipment, donated money, physicians coming in, and people who would offer charitable contributions for these clinics. I think their contributions ought to be given full tax credits. That would put a whole lot of private money into people's free health clinics and into helping people who don't have insurance. They can simply go and find the local free health clinic. I think you'd see a whole lot more of that, and people would certainly be encouraged to support that if they could get that to come off. That would come off their taxes. It would be better to do that than to force them to pay higher taxes to get in the federal bureaucratic system that we're looking at with Obamacare.
Healthcare policy. Our government made a serious mistake when we passed into law the National Health Care Bill about a month ago. We need to repeal that law. We need to defund it. We need to do anything possible to get it off the books. We do need meaningful healthcare reform, but that meaningful reform starts with getting rid of what's in place right now. Now, I've been frustrated with our own congressman. He did not announce a position on that until Thursday when the vote occurred on Sunday. While others around the nation made their minds up and announced their vote well in advance, our congressman seemed to have difficulty announcing what his position was. The bill passed on Sunday by a handful of votes, and then on Tuesday he released a statement that said the calls to repeal that are strictly political and that he would not vote to repeal the bill. Well, I'm not sure whether he's against it or whether he's for it. But I also feel that I need not just to tell you what I'm against, I need to tell you what I'm for. Our healthcare system is perfectly designed for the post-World War II economy, where an individual goes to work for one company, they work for that company the entire rest of their life. Many individuals were employed in very large manufacturing concerns, and that's where you got your health insurance. Well, the economy of the 21st century is very different. We have an unprecedented number of small businesses. We have an unprecedented number of people that are self-employed, work out of their homes. Those individuals don't get the same tax advantages in their health insurance that a corporation gets. A very simple change would be to allow individuals the exact same tax treatment for healthcare premiums that are available to corporations. Secondly, we need to allow those individuals to come together in buying pools so that they can have the leverage and the buying ability that a large corporation has. A one or two person shop simply does not have the ability to go to the marketplace like a large corporation with several thousand employees. But if that one or two person shop could be in a buying pool through some type of association, their professional or trade association, they could have the same buying power that a large corporation has. We also need to make it illegal for any health insurance company to ever terminate a person for using their policy. That's why you buy the insurance in the first place. If a person has insurance, we need to allow a person to move from one plan to another and exclude pre-existing conditions. We need to have meaningful tort reform. That's made a significant difference in the state of Mississippi. And I'm proud to have been one of the legislative leaders in accomplishing that. We saw medical malpractice insurance go down significantly following tort reform. And then finally, we need to have more transparency. If a person goes to the hospital, when they're discharged, they get a bill that's 3 inches thick and they can't understand anything that's on the bill. They can read the words, but they don't know how they were charged. And so we need to have much more transparency in the billing process. I think if we do those things, the effect it will have is to put the patient in charge rather than put the bureaucrats in charge, which is what we have under Obamacare. Also, it would put the patient in charge rather than put an accountant in charge, which is a problem we have in some existing health plans right now.